Hello, my name is Promise Ohiri. I'm a fourth year pharmacy student at Ben and Métis Fish College of Pharmacy, and I'm going to be talking to you about the medication Adapalene and benzoyl peroxide today. Its brand name is Epiduo or Epiduo Forte. So just a brief background information on this medication. It is classified as an anti-acne agent and also a topical retinoic acid derivative because adapalene is a retinoid-like compound which works by controlling cellular replication, keratinization, and inflammation process of the skin cells, while benzoyl peroxide is an antibacterial agent that helps oxidize bacterial proteins on the skin follicles and also decreases the number of bacteria and irritating type fatty acids that could lead to the production of could lead to the formation of a pimple or an acne. So how do you use this medication, or what are you using this medication for? We use it for the treatment of acne and or pimples. Some people also call it acne vulgaris, which is more of a technical term for it, but it's just for treating acne and pimples, if that's what you like to call it. And then what would you like your doctor to know before you start using this medication? We always recommend that patients tell their doctors or their pharmacists that if they have had any sort of allergic reactions to any medication in the same class. You might not know, but just letting your doctor know that you've used other acne medications and they didn't work, or this is how I reacted to this one acne medication that I tried. It's very good information for us so we can know how we can narrow down your therapy. Also, telling your doctor if you're using any other medications that can make your skin a little bit more sensitive to light is also very important. And letting your doctor know if you're taking any other prescription drugs, over-the-counter medications, some herbs, natural products, vitamins too, is also very important. And how do you use this medication? It's always important that you use the medication exactly the way it has been written for you on your prescription label. Those are the directions that the doctor has provided for you based on your skin type and what he has diagnosed you with. And then also want to follow these mild instructions, making sure that your hands are clean before and after you use this medication, and also making sure that before you apply this medication or put this medication on your skin, that the area where you'll be putting this medication on is completely clean and dry. And then you can just use a pea-sized amount. You don't need a lot. Actually, a small amount will go a long way. Just apply that amount to the affected area and rub it in gently. And then you can follow up with a mild facial moisturizer. We also always recommend that you use sunscreen in the morning or just as the day goes by when you're using this medication, because it has a tendency to make your skin a little bit more sensitive to light. Things to watch out for while using this medication. So concomitant use with this medication and other topical products can actually cause strong drying effects to the skin. So like I said before, let your doctor know other topical medications that you're using on your skin, other acne medications that you're trying out, and then you will also want to use medication just for your skin and your skin alone. It's a topical agent, so it doesn't go into the mouth, it doesn't go into the nose or the eyes. If it does get into any of these areas, just rinse it with water and hopefully you can feel a lot better. If it doesn't resolve, or if the effects doesn't resolve in about a minute after you've done what I've just said, rinsing it with water, please reach out to an emergency care unit and just let them know what happened, and they can take care of it from there. And also, this medication has a tendency of having a bleaching effect, and it can bleach your hair or your colored fabrics. So just be mindful of that and keep an eye out for that. And also, do not apply this medication on cuts or abrasions or sunburned skin, because it could lead to more irritation of the skin. And then in terms of pregnant women, so it's not currently known how this medication will affects pregnant women or breastfeeding mothers. So we cannot completely rule out the fact that there's a possibility of fetal risk. So we don't recommend this medication, and sometimes we just have to use our clinical judgment and assess the benefits versus the risk for the mother, and then that's usually how we come to a conclusion if a mother is a candidate for this medication or not. But please discuss with your doctor and just let them know that you're pregnant, you're planning to be pregnant, or you're currently breastfeeding, and that can help them make more clinical judgment on whether this medication is right for you or not. And some side effects to watch out for while you're using this medication: burning and stinging. So people experience this maybe because your skin is cut, or you have a cut, or the skin is too dry. And then application site irritation. This is something that happens maybe because It's just a reaction to your skin to a new product, or your skin just doesn't like the product. It could be a bunch of different things. And then also the skin can also react by being very, very dry. It can turn red. The skin can start swelling, or you start having blisters or peeling. And the more serious adverse effects would be things like hives and swelling of the face and hands, difficulty breathing, chest tightness. This could be a sign of anaphylaxis. This is a sign that you probably need to reach out to emergency care unit immediately, or have someone call 911 immediately for you. And then finally, what happens when you miss a dose? So if you miss a dose, you currently want to go ahead and apply a dose as soon as you can, or as soon as you remember. If it's almost time for your next dose, you can go ahead and wait and just continue your normal routine. We do not recommend that you put on 2 doses at the same time. Again, follow the instructions that your doctor provided for you on your prescription label. And then finally, for storage, we store this medication in room temperature. We don't refrigerate it, we don't freeze it. You also want to put it away from light, and then just keep it away from moisture too. Just keep it in a cool, dry area, room temperature, and it should be fine. And that's all I have for you today. If you do have more questions about this medication, you would like to learn more about it, reach out to your physician or your local pharmacy, and they can provide you with more information on this. Thank you. Have a good day.